presentation on the overall benefits of the electronic health record. The information in this presentation was taken from Georgetown University's Health Information Technology course. It was created on July 25, 2008. Throughout this course, students have been presented with data about the various benefits of the electronic health record. The data provided shows EHRs to have a positive impact on quality of care and efficiency. When examining the impact on quality of care, some studies show electronic health records drastically reduce medication errors, which is a major problem in the current U.S. healthcare system. Medical errors are estimated to cause over 98,000 deaths annually and cost hospitals approximately $38 billion a year. Electronic health records are also said to increase worker productivity by increasing documentation time among physicians by approximately 17%, while computerized physician order entry increases documentation by nearly 98%. When examining the impact on efficiency, there are a number of areas studied. However, this presentation will look at billing optimization, malpractice reduction, and improved outcomes. When looking at billing optimization, a healthcare organization's ability to improve the retrieval of charges and fewer billing errors can lead to a savings of over $86,000 a year over a 5-year period per provider. Healthcare organizations also believe that EHR and computerized physician order entry may result in a reduction of malpractice, this being due to the assumption that insurers will lower premiums of providers who utilize EHRs. The assumption also states that EHRs will have a positive impact on outcomes due to clinical staff's ability to track accurate information on patients. However, there are always two sides to every story. As previously stated, much of the literature throughout this course has been on the benefits of electronic health records. However, it is important to also examine the adverse consequences of electronic health records. In response to the Institute of Medicine's 1999 report to Err is Human, and initiatives promoted by the Leapfrog Group, the University of Pittsburgh School of Medicine, together with the Children's Hospital of Pittsburgh, implemented computerized physician order entry systems in an effort to reduce medical errors and mortality. For the purpose of this study, demographic, clinical, and mortality data was collected concerning all children admitted to the facility over an 18-month period. During this time, a CPOE program was also implemented. The results of this study are astonishing. Among the 1,942 children referred for specialized care, 75 died, for an overall mortality rate increase of 3.86%. Mortality rates before the CPO implementation were 2.8% and increased to 6.57 after implementation. In conclusion of this study, an unexpected increase in infant mortality was observed. This increase coincides with the CPOE implementation. Although CPOE and EHRs are excellent tools to reduce human error, healthcare delivery, the findings in this study suggest that CPOE implementation should consider children who are dependent on time-sensitive therapies. In the article entitled Types of Unintended Consequences to Computerized Provider Order Entry, researchers sought to identify various types of clinical unintended adverse consequences of CPOE. Information was gathered from 5 successful CPOE sites. From this study categorized 79 unintended consequences and 245 additional adverse consequences. These unintended adverse consequences, or UAC, fell into 9 major categories. More work or new work for clinicians, unfavorable workflow issues, never-ending system demands, problems related to paper persistence, untoward changes, in communication patterns and practices, negative emotions, generations of new type, generation of new types of errors, unexpected changes in power, structure, and an overdependence on technology. The extent of these unintended consequences are also an important and necessary factor to look at. Prior research has failed to quantify the extent to which hospitals experience and unintended consequences of EHRs. Unintended consequences of CPOEs are especially important because they surprise implementers. It is an important goal of previous and future research to identify the types of unintended consequences so they can be monitored and managed. Once these unintended consequences are predicted or detected, their management can involve trade-offs. In this next study, researchers conducted studies in 3 countries, the United States, the Netherlands, and Australia. These studies investigated the implementation of Patient Care Information Systems, or PCISs. This study proved that PCISs foster errors rather than reduce their likelihood. The silent errors named in this study are errors in process of entering and retrieving information and errors in communication and coordination of care. In conclusion of this study, researchers feel since potential causes of these errors are subtle, however insidious, the problem must be addressed. This must be done through improvements in education, system design, implementation, and research. Many advocates for the electronic health record suggest that EHR implementation will lead to lower costs. However, research has shown that this is not the case. In fact, studies have shown that EHRs often lead to higher billing and declines in provider productivity. In the case of worker productivity, a study conducted by Kaiser Permanente showed a 5 to 9% decrease in office visits, and EHR's ability to provide labor savings is also questionable. Additionally, EHR implementation fails to optimize billing. This is because EHRs have little effect on providers' documentation. Providers are known to underdocument. The argument that EHRs aid in the reduction of medical errors. However, this is not true according to the Agency for Healthcare Research and Quality. In conclusion, currently EHR and CPOE technology is immature and rapidly evolving. Improvements are both warranted and attainable. However, the field of health information must prioritize ongoing efforts to better understand the nature of clinical work. Designers must build systems that respect healthcare providers' burdens, and consistent feedback from providers must guide implementation and evolution of the EHR. The following slide contains a list of websites used to gather information contained in this presentation.